Hi, I'm Dr. Vinatha. I'm a senior consultant in Cloudnine Hospital, Hitech City branch in Hyderabad. So what can we do to try and prevent a prolapse? Prolapse is known to happen in many women. Almost if you reach the age of 80, an alternate person, 1 in 2 women will have a prolapse. If you are 50, 1 in 3 to 1 in 4 women will have a prolapse. It is so very common. And it makes us think, so there is nothing for us to prevent? Not really. We can do something to try and reduce our chance of having a prolapse or reduce the intensity of having symptoms. So what are those? First thing is our general health. So how are we maintaining our health? Are we overweight? Are we underweight? Are we having a lot of problem like, you're not doing any regular exercise and having problems with diabetes? Trying to control our own medical problems will go a long way. If someone has a trouble having constipation all their life, there is a lot of strain on pelvic floor that can lead to prolapse. So what we have to do is try and reduce the risk of constipation. Drink a lot of water, have fiber-rich food, or when it is required, use a laxative. So the amount of strain that we have on the pelvic floor is reduced. This is over the years. If you imagine, if you have that strain, that will increase your chance of prolapse. The second thing is someone with chronic cough problem. They always have an allergy or cough which goes on for months and months. Then that also has a lot of pressure on the pelvic floor. So we have to try and get the treatment faster. So the pressure on the pelvic floor is reduced. This is about our general health. So what you have to do specifically to the pelvic floor is by doing Kegel's exercises. These are also called pelvic floor exercises. These are done when as if you have to suddenly stop yourself from passing urine or motion. So that squeeze of the pelvic floor, doing this often will help you to prevent a prolapse, or when the prolapse is in very early stage, we can reduce the worsening of the prolapse. How do we have to do it? Squeeze the pelvic floor as if you are stopping to pass urine and motion. Do it a quick one squeeze and relax. Same things has to be repeated around 8 to 10 times, at least 3 times in a day. So how do you have to remember? You don't have to stop doing anything to do an exercise. This Kegel's exercise can be done when you are actually doing something else. Like you are sitting and eating, same time, remember and concentrate on your pelvic floor, and that is all you have to do. So make sure that becomes a habit, and that is how we can prevent a prolapse.